Hi, my name is Vimbai. I'm Head of Psychological Therapy Service for Bromley Working for Wellbeing, and I work for Bromley Healthcare. Today I want to talk to you about depression. Quite often people feel really depressed or feel sad, hopeless and helpless, and don't quite know what to do with it. So hopefully this talk will help you understand it a little bit and have a think about what sort of support you might be able to get for your depression. Now, depression is, you experience depression, people who experience depression will experience different symptoms. It's not the same for everyone. But the general rule is that when you experience depression, you have symptoms of low mood, you may be really tearful, or you may just completely lose interest in the things that you used to enjoy. That is generally what people will experience. But more specifically, you have physical symptoms of depression, and you've also got psychological symptoms of depression, which then is shown in social aspects of your life as well. So physically, you may experience the inability to go to sleep, or struggle, with sleeping, waking up early, or not going to sleep at all. You may also feel quite tired all the time, feel really quite tearful and unable to cope with the things that you used to do on a day-to-day basis, really feeling lethargic and not finding any interest in the things that you used to find quite a lot of pleasure in. But also quite often people have a loss of libido and just struggle with relationships as a result. Now, psychologically, people's thoughts tend to be quite negative, with a sense of feeling guilty a lot of the time, low self-esteem, worried about things that happened in the past, and unable to enjoy what's going on in their lives at present. But also they can be characterized by tearfulness, struggling with work, struggling with relationships, and also what we find is that when people are really depressed, they will tend to avoid any social gatherings, or probably have to wait for their friends to contact them instead of them contacting their friends. Just that complete sense of feeling hopeless and helpless and unable to face day-to-day life. But also on the extreme end, you have people who just feel so depressed that they just want to end it all. And that is more at the extreme end. But, feeling sad is something that we all experience, and it is quite normal. But when it goes on for more than 2 weeks and you experience those symptoms every day, then that is then depression, and you perhaps will need to get support from your GP. And in terms of treatments, I do have good news for you. You can get treated for depression. It isn't a death sentence to experience depression or to feel depressed. And there's lots of treatments available. If you experience mild symptoms of depression, self-help is available. And you can help yourself by keeping yourself active. So research has shown that exercise is really helpful in increasing your confidence and helping you to feel better. Going out of the house, meeting friends, just generally being active and not staying stuck in the same place and in the same environment. Also, just taking notice of things around you, so taking a walk and looking around you, just seeing things that perhaps you hadn't seen before, because that's one of the first things that go when you're feeling depressed. You lose that sense of wonder and the inability to take in things that are going on around you. But if you start suffering from mild to moderate depression, you would then, what has been found helpful is talking therapies. And talking therapies are, you can get talking therapies from your GP in the form of counselling. You can also have cognitive behavior therapy. This is an evidence-based therapy that looks at how your thinking affects how you feel and how you behave. And hopefully, if you can change how you think and how you see the world around you, you're more likely to then change how you experience the world around you. There's also what's known as interpersonal therapy, which is also quite helpful in dealing with long-term depression. And generally, most boroughs will have these therapies available via IAPT services, which is improving access to psychological therapies. But for those experiencing moderate to severe depression, your GP will probably prescribe some medication, some antidepressants for you, and you may have a combination of antidepressants and talking therapies to help you through the depression. I hope that information, I hope it's been helpful and that you've been able to get a lot out of the information. Thank you.